Hi, everybody. Welcome back. This time, I want to talk about something that I get asked from time to time, having to do with the fact that I'm so troubled by psychiatry's claims, psychiatry's behavior, and it could leave somebody with the impression that I'm not really much of the belief that you can get help. Is there any help out there? According to Dr. Coleman, and most certainly I do believe there is. And I think there are some things that I'm happy to talk about because I've been asked this many times before on radio or TV shows that I've been on by people that I know. Well, what would I do if I needed help and I wanted help? You know, you're talking a lot about involuntary, but what about somebody who wants help, recognizes that they need it? They can tell by how they feel. They can tell by what they want to do or don't want to do, by their life and their habits and their, many kind of symptoms they could be having. And I not only have talked about that in some TV show, radio, and to conversations, but I even got asked a few years back to write an introduction to a book by two social workers here in Berkeley. And the title of their book was called When Talk Is Not Cheap. I forget the name of the second author, apologize for that. But at any rate, the book's called When Talk Is Not Cheap. Mandy Aftel was social worker, one author, and Robin, I'm going to get help in a minute and get that name for you. And one of them was a linguist, the second was a linguist, and I thought that was a pretty clever title, and I was pleased to write an introduction at their request because they knew of my views about psychiatry, that I didn't believe in involuntary treatment. I didn't like all the drugs that were being foisted on people. And so I wrote an introduction, and I said the things that I'm going to now say to you. The first thing I say to people is the fact that you feel like you need help is all the information you need to know that you should get some help. Why would you feel that way if you didn't? It wouldn't be a good idea. The next thing I say to them is put a psychiatrist at the bottom of the list of the people that you would think about going to. That's not because psychiatrists are not smart people. I've met many of them who are very caring people, and I don't doubt that's the vast majority, like in any other profession. But I would put them at the bottom of the list because their training puts so much pressure on them to emphasize the use of physical treatments, drugs primarily, and that in their world, so much pressure can be put on them to do that. So much pressure can be put on them if they feel it's necessary to take it out of your hands as to whether or not you would be in a hospital against your will. So that would be my advice to anybody who's looking. First of all, is consider the other mental health professionals first. Then the next thing to do would be to shop around, meaning even though you might be feeling like you don't feel like shopping around, and this is word for word from my introduction, the last thing you might feel like doing when you're feeling emotionally in distress is start talking to several possible therapists and then deciding. You would very much like to find one sooner rather than later. But I think your gut level feeling about how you're related to a person would be terribly important in deciding who you should see. Remember, this is not a science. Helping somebody who's having trouble with their mental, emotional life is not a science. It doesn't mean there's nothing valuable there. Far from it. Wisdom and experience count. but it's not science, and therefore you can't go in a strict way by credentials, meaning this person with this kind of credential will be better, and the next will be this one and this one. Talent, humanity, intelligence is what will go to make up the best person for you. Maybe that therapist will be really good for a different kind of person, but you're looking for the therapist for yourself. So ask around amongst the people that you know. That's the first thing I would do. Look for 2 or 3 names of people who have been in the community, who have a good reputation, and who are not identified with a mental hospital unless you yourself already feel that that's what you want to do. Then, fine and dandy. Who's to say that a mental hospital may not be a good place for you if you feel that way? Then what I would do is I would make an appointment with 2 or 3 people. And when you talk to them, go by your gut level feeling of how they react to you. And don't be afraid to ask them. If you have feelings about forced treatment, don't be afraid to ask them how they feel about it. Ask them, do they ever use forced treatment? Most of them will probably say, sometimes I feel I have to. There's not many people who are willing to do what I decided to do. I'm not going to defend or, get into the need to try to defend the fact that not many people agree with doing that. But if you ask me the question, I'm going to recommend what I believe in. So ask them, well, what kind of situation? If you feel that you are actively suicidal, you're seriously thinking about it, then you should seriously think about whether it's safe for you to go to a therapist, because most of them are going to be too scared not to try to hospitalize you against your will. That's just the way it is. You may, if you're so determined that you don't want that to happen, then you may want to try to get help in a different way. In my experience, most people who feel that strongly and are thinking about the fear of involuntary treatment are in that state of mind because they've already had involuntary treatment and they were so horrified by it that they don't ever want it to happen again. But that can be a dilemma. I hope that the person who's asking this question is not in the situation where they are not thinking about that. Personally, I rarely think that the possibility of suicide is ever a good option. I think that only in situations where terminal illness or some other such things. I think that most of the time when people are thinking about suicide, it's because of reasons that are not really good reasons to think about it, that you can get past it. And with the right kind of help, you can get past it. People think about suicide because they can't see a way out. They feel the pain is just going to keep on going, and they just can't see how they can get out. But that's because they're in the middle of it. I happen to think that once you start forcing something on them, you then will drive them away from the help that can get them to realize that they can get past it. So most people, the very fact that they would ask the question of somebody, they're not at that state yet, or they wouldn't be asking, well, what can I do? So I would give them the recommendations that I've just given you. Look for somebody who's well-credentialed, in the community, has a good reputation, is not tied in with a lot of regular over-drugging, not ready to use shock treatment if you're not feeling better in 3 or 4 weeks, as we heard on the 60-minute program, where they said if you haven't responded to treatment for depression, but they never once ever uttered anything about what was the treatment for depression other than drugs. 20 or 30 different drugs you heard about if you watched that program. Well, that's not my idea of how to help somebody with depression. Just put them on drugs and wait and see whether they respond. So there's a lot of things that can be done. Most people want help. They want to find a way out. And if they run into somebody who keeps them in charge but understands that they need help, they can be helped to get past it. So that's my answer. Now, some people want to know more than that, They want to know, but I want to know what you would do. I want to know exactly what, in a kind of desperate tone. And I never allow myself to feel like, gee, I have to give them an answer, because you know what I would be doing? If I then went on to say, well, I think you need to do this and you need to do this, then I'd be falling into the same trap as those people who think you can diagnose a disease and look in a treatment manual, tell you, oh, well, if you have 200.7, you do this. We're talking about people, human beings, and all the complexity that goes into that. I wouldn't know any more specifically than what I've already said without being familiar with that person. The last thing I would do is immediately think about a drug. I might think about a sleeping aid for some number of days, possibly, but I would not fool myself or try to fool them into thinking that I was treating a disease. We want to give them a period of respite, of safety. That could be a time where medication, with the patient's agreement, could be useful. So that's the best I can do without knowing this person, but I think would be ahead of what we're doing now. Thanks for coming, and I'll see you next time.